Hi again, psychologist Peter Lambro with you to ask you a couple of questions. Do you regularly use any form of assessment or measurements in your work with clients? Do you ask your clients or patients to set measurable goals, even to set timelines for accomplishing specific therapeutic tasks? Do you encourage clients to write or maintain some form of therapy journal? The connection between these questions is that they all require some effort on your part as a therapist. So why would you bother with measuring when it takes so much time? And you may not even get paid for much of that time. Well, there are several very good reasons. Studies show that administering psychological measurements can improve the therapeutic alliance and lead to more positive therapeutic outcomes. Also, when therapists measure before treatment and periodically during treatment, they can better see what works and make needed adjustments to improve the therapy. Here's the bottom line though. If measuring, say, depression, anxiety, stress, self-compassion, addictive behaviors, or any mental issue, it isn't easy or cost-effective, and you may not take the time to give assessments if that's the case. Many therapists use a simple paper-pencil measure once, but seldom follow up to assess progress because it takes too much time. This means therapists are missing good opportunities to build the therapeutic alliance and help their clients reach the best possible results. There is certainly a powerful and positive effect in showing a client an objective measure of, say, their anxiety symptoms and comparing the results from the beginning of treatment with their progress after a few short sessions. The client can see change has occurred. Now, of course, clients may subjectively notice that they're feeling better, but seeing the evidence on an objective measurement builds confidence and motivation for even more improvement. It also builds your confidence that what you're doing is helpful. There's an axiom from the business world that's worth considering in any business, and in ours as well. You can't manage what you don't measure. Measurements at the start of therapy can also give you some specific information to help you save time developing a treatment plan. Naturally, the clinical interview of a new client is certainly important, yet having some assessment that lets you know a client's strengths and areas of weakness, symptoms as well as other factors, helps you make the initial interview with a new client more meaningful. I'm going to tell you about a way to simplify the process of assessing your client's needs. It's the Therapy Rewind system. In addition to allowing you to easily deliver and monitor homework, the system has built in several valid, reliable, and effective measurements. We've automated these measurements to simplify the scoring process for you. Literally, with the click of a button, you can invite your client to take the assessment, and before they come to their first session or any subsequent session, you can print and review their results during the session. All this is done in a secure environment. Now imagine being able to easily administer and measure clients for critical issues like depression, anxiety, stress, addictions, and with the click of a button, the results are scored for you. And the total time for you is a minute or two to select and click the appropriate measurement. It makes re-administering the assessment at any other point in therapy just as easy. You know, the field of medicine is using technology in significant ways already with electronic health records, automated lab tests, ultrasound to non-invasively see internal organs without radiation. Heck, patients can swallow a miniature camera pill to record the entire gastrointestinal tract, and with a myriad of other high-tech methods that make news almost every week in medicine. The field of psychology, counseling, and therapy is gradually moving in that direction, and while our objectives may be different, inevitably the demands of time and money will mean therapists will either incorporate technology or they will be left behind. Young therapists coming out of universities today are already tech-savvy, and they're enthusiastically embracing the opportunities to use technology to be more efficient and more effective. And it's happening at an even faster pace than the graduates of the previous decade. And therapists who are seasoned and experienced and want to have the sorts of practices, whether they're private, public, or in a clinic or hospital setting, will either incorporate technology or find they become boutique practices that are quaint, but losing ground year after year. One way you can be part of that upward curve of efficient, effective use of technology without a capital investment and without long-term financial commitments and for the cost of a modest dinner for two is with the Therapy Rewind system. A modest monthly fee with no contracts, no obligations, allows you to do some unique and effective processes that help your clients while saving you effort and time. Here's what you can have available to you right now. 1. A system to deliver standard homework assignments of your choice and easily create your own. Plus, Therapy Rewind system provides an easy way to monitor the completion of your assignments. 2. You can deliver built-in measures of anxiety, depression, stress, self-compassion, addictive behaviors, and more, all scored for you and available for printout in time for that first session or any subsequent session. Third is a substantial and growing library of articles, audios, assignments, and other resources you can select and deliver to a client with a click of a button. In addition, the system allows new clients to complete intake and other forms online, and you have it before they even arrive. There's much more that the Therapy Rewind system can do, including setting and tracking goals, journaling, notes you can create for yourself, and other features. Now imagine all that I've described is stored in a HIPAA-compliant, secure system that your clients can return to and rewind to any previous session for review. And even after you've completed therapy with your client, they can access any part of what you've provided them. The Therapy Rewind system allows you to send a follow-up message with as much personalization to show you care, and it remains in a confidential environment, not in some cyber fishbowl like regular emails and attachments or texts. Take the next step and subscribe today and take advantage of our special offer. And know that you'll lock in a great investment even as our system continues to evolve and improve. And by the way, we have a team of specialists at hand to help you as much as you need along the way. We look forward to working with you. This special won't last long, but when you subscribe today, remember, you lock it in, no bump ups later. Click the link below and we'll help you get started right now.